Hello, everyone, and welcome to Conduit Healthy Communities Institute's webinar on Rethinking Community Health Planning with Reid Health. And my name is Jane Chai, and I'll be your moderator today. As you're joining us, please feel free to share your name, your organization, and where you're joining from today. As I mentioned, my name is Jane Chai. I'll be your moderator, and I'm joining from Orange County. And I'm with Conduit Healthy Communities Institute. I should say that's Orange County, California. So we're so glad that you're joining us today. I'll go ahead and start us off by sharing some logistics. First, you've all joined this event as an attendee, so you're automatically muted for the duration of the webinar. Again, we'd still love to hear from you, so you can introduce yourself in the chat box. And as we get going, if you have any questions or comments during the presentation, please feel free to share them in the chat, and we'll be reviewing your questions as they come in. We'll try to answer as many questions as we can throughout the presentation in chat, but we will have a Q&A session at the end of the presentation, so we can bring it up at the end at that time as well. And lastly, I know folks are always asking if a recording will be provided, and yes, a recording of today's presentation will be made available at the end of the webinar. So for those of you who don't know, Conduit Healthy Communities Institute, we've actually been around for a while. We've been a leader in community health field for over 17 years. We've conducted hundreds of community health assessments and implementation strategies with our partners across the country. We're also known for our nationally recognized platforms that provide continuously updated health and social determinants of health data and acts as a hub for community health activities. So our team really brings both a combination of advanced public health degrees and real-life experience in community health improvement. For this webinar, we're so excited to be sharing Reid Health's CHNA journey. They've truly done some amazing things with their CHNA, and we know that many communities struggle with partnerships and what to do with the findings of their CHNA, especially when they emphasize the need to address social determinants of health or social drivers of health. Reid Health has really taken this on headfirst, authentically and regularly engaging their partners and community and finding meaningful ways to support programs addressing social determinants of health. So with all that said, we hope that we do justice in sharing their story today. And by the end of the webinar, we hope that you will learn data collection methods to reach broader community voices, understand ways to use local data to guide funding and programming, and use shared platforms and public data tools to align funding and community needs. And I'll go ahead and start off by introducing our speakers for today. I've already introduced myself, Jane Chai. I'm the Community Health Content Expert for Healthy Communities Institute, and I'll be acting as our moderator. And I have the pleasure of introducing our presenters. So first is Katie Stephen. Katie is the Community Engagement Specialist at Reid Health. Katie has spent the last 6 years building strong connections in the community while leading efforts through nonprofits that support youth, families, and collaborations with local organizations. She serves on several board of directors for local non-for-profits. Katie strives to help others be the best version of themselves. Her leadership style is bold, purposeful, and detail-oriented. She is rooted in a strong belief in showing up, speaking up, and building lasting impact. Next, we have my colleague, Era Chowdhury, from a consultant at Conduit Healthy Communities Institute. Era has over a decade of experience in population health. Since 2018, she's supported clients in conducting community health needs assessments, developing implementation strategies, and advancing health improvement planning. With a background in data research and a global perspective shaped by work in India, Era specializes in translating complex data into actionable insights that drive equitable, evidence-based public health solutions. We also wanted to thank Jess Shibish from Reid Health. She's the Director of Community Health and Engagement at Reid Health, and she really helped in preparing for this webinar. You may have seen Jess featured in earlier communications about today's event, and although she was unable to join us due to unforeseen circumstances, we're grateful for her time and effort behind the scenes to help bring this webinar to life. You may also notice a couple other names that appear on your screen. Eddie Gomez and Eileen Aguilar are my colleagues at Conduent Healthy Communities Institute who are helping with some of the behind the scenes aspects of this webinar, but will not be on camera today. So now that we've fully introduced ourselves, I'd love to hand this over to Katie to talk a little bit about Reid Health, maybe share some background about Reid Health and your CHNA journey. So, Katie?
Thank you so much, Jane. I really appreciate the warm introduction, and I'm excited to be here and share all of the work that we've done. So first, I'll just share a little bit about Reid Health. So Reid Health is a regional hospital health system serving East Central Indiana and West Central Ohio, with a main hospital campus here in Richmond, Indiana. This includes the hospital here in Richmond, Indiana includes 227-bed inpatient hospital and numerous satellite locations in 7 of our regional counties. Reid Health System and Physician Network, Reid Health Physician Associates, we have about 3,200 employees, including more than 300 providers and 40+ specialty offices. Reid's community benefit footprint covers Wayne, Henry, Randolph, Fayette, Franklin, and Union counties in Indiana, and Darke and Preble counties in Ohio. And as you can see on the slides here, we did break down for our population, which in total is about 284 people population that is our service area. Wayne County is where the hospital is located, like I mentioned. Our CHNA footprint covers each of those counties with intentional efforts to include all populations, so each voice is heard. So I will touch base on some of our partners and some of the work that we do. So at Reid Health, we know that we cannot do it on our own. There is more than enough need to go around for everyone. So Reid really prioritizes partnerships with entities across all of the various sectors, including city and county officials, city parks, school systems, higher ed, non-for-profits, faith-based organizations that serve the community, health departments, federally qualified health centers, crisis centers, police, local chambers, foundations, and more to really just improve the overall health of our neighbors and community. So some of these partners vary in different forms. So our work groups, Reid staff are on several different work groups in the community related to health needs, including food insecurity, substance misuse, car seat safety, and that's just a couple of them. Some of the coalition work that we do, we have staff that attend drug coalition meetings in several of our counties for our service area. We also host a drug tobacco coalition here in Wayne County. And some of the board involvement for our Reid staff, we do encourage anyone really to sit on health and wellness related boards and to give back to our community. Some of the health education partners that we have a grant that covers health education. So our community health workers go out into the community to some of our partners and really embed themselves in a setting with populations that they serve. So this allows us to meet people where they are, and they have a fixed audience during those different one-on-one interactions. We encourage our Reid staff to volunteer their time with the partners that we serve and really assist in different food distributions, meal distributions, events, really other needs that arise. We always encourage them to help and volunteer because, like I said, we cannot do it on our own. So we know our partners can't do it on their own. Grant making. So Reid has a grant cycle built around the prioritized health needs that we find within our CHNA. And these make eligible organizations apply for funding to help move the needle on the indicators and the health needs, which again, like I said, we find that through the CHNA. So not only do we do the continuous work to recruit, build, maintain, and sustain these partnerships, we also encourage partners between the different sectors and organizations. So we connect partners together who are doing like-minded work to be able to share ideas, resources, figure out what works for them, and really build upon each other. And some of the lessons, like if there's something that happened during an event, we encourage them to share lessons with one another. We are more than just a health system to our community. We act as a connecting piece to the puzzle. We continuously are analyzing and being able to help with the needs and being able to put people and organizations together when it makes sense. So within our partnerships, I want to highlight a couple that we have. So in Reid's implementation strategy funding, each year we find organizations who have capacity and ability to assist us with improving the health of our community. So specifically organizations who work aligns with the activities and initiatives on the implementation strategy. So the partnerships that I've highlighted here, one being the Richmond Parks and Rec. So Richmond Parks is located here in Wayne County, and it's the highest populated county in Reid's service area. So the park director prepares a funding proposal and submits it to us, and this will align with the prioritized health needs and identify gaps to improve those needs. So this plan is reviewed by myself and the administration team, then goes to our well-being committee, who oversees the community benefit initiatives here in our health system. And then we have it sent to the board of directors here at Reid Health. A few of the activities in this plan particularly are the SNAP, which is the food stamp, and the WIC, which is Women and Children in Need assistance programs, by doubling the purchasing power at the local farmers markets in our service area. So the park runs the market in Richmond, Indiana, and offers it in different locations centrally to the surrounding counties. And earlier I spoke about the importance of partnerships. We enhance this partnership by assisting the parks with promoting this program. So our community health workers, along with myself, take flyers out to talk about this program and enhance the reach and maximize the use of the program. We've seen a lot of results of the SNAP dollars and be a higher, really it's higher than ever before. We have our community members that are utilizing these SNAP double dollars. And if you pour into your partners, they will pour back into you when it's time for your CHNA work. So asset mapping and really like the collaborative workshops and work groups that we have, pour into your partners, they'll return the favor. Another initiative that I want to highlight is the Get Healthy in the Parks. And it was led where the public can sign up for a walking club and walk as a group in the park. And this has several benefits, obvious benefits with, just physical activity, but it also helps with the mental health and isolation. And the walking group creates a connection and community with walkers, reporting improvement with mental health. And resources and education are also shared during this time. So I will continue on with some of the work and some of the highlights we've had with our CHNA over the years here at Reid Health. So Reid Health has partnered with Conduit and completed the CHNA since 2015. For the first CHNA, it was produced and shared to the public in 2016. So I would like to highlight some key metrics and initiatives for each of the CHNAs that we were able to complete. I want you to understand and really see the evolution and the transformation of the approaches to engage the community. So in 2016, we had 769 responses. Jump to 2019, we had 1,168 responses. In 2022, we had 1,051 responses. And I'm very proud to say in 2025, we had 3,649 responses for our survey. As you can see, that was a huge jump in 2025. And we began our planning in late 2024. So yes, it does take time and it takes a lot of energy and that, your brain really is going, but it's really worth it. And knowing that we need to leverage established partnerships and all of that work and be very strategic to reach individuals from all walks of life. So this go around, we were very community focused, taking our survey to where the people were. We visited meal sites, community events, and other places just to collect the responses from everyone.
Yeah, thank you so much for sharing that, Katie. I think that is a really impressive number. And I think what's even more impressive, though, is not just the number, but the engagement that you had, and the groups, the types of people that you were engaging in, groups that you were engaging. So really, congratulations. Now I'd love to introduce Era back into the conversation. Era, I know you were helping Reid Health with this last CHNA. Could you share a bit more about Conduent's involvement and approach to the CHNA you conducted?
Yeah, sure. Thanks, Jane. And thank you, Katie, for walking us through how Reid Health CHNA have grown over the years. I have been with you all, I think, since it's been 6 years now. This is my third cycle that I've done CHNA with you. I love seeing how intentional the team was about really meeting people where they are. Building on that, I'll share a little bit about Conduent's approach, how we are partnered with Reid Health to support this whole process. So on this slide, you can see our approach to community health planning. It really guides how we develop our technology and collaborate with our clients. So first, we take the holistic view of data across all human experiences. So not just the health outcomes, but also social and economic indicators, and to uncover the root causes of health inequities. Our platform really includes over, I think, 150 indicators with state, national, and all the trend comparisons that are available. And then we work with our clients, such as Reid, to layer in their local data by looking at the breakouts of race, ethnicity, age, gender, geography, wherever it's possible. So we can get a better understanding and identify disparities that are unique to each community. And finally, what we do is we do believe that the lasting change happens when we work across sector and engage people most impacted by these disparities. And that's why it has been so exciting to see what Reid Health has accomplished through their partnership and community-driven approach. Up next is I want to go through what we did when I partnered with Reid Health on their community health needs assessment. One of our first goal was this year to shift the mindset from compliance to connection. Traditionally, CHNAs were about checking boxes, collect the required data, submit the report, and repeat it every 3 years. It met the standards, but it didn't always move the needle on community health. So with Reid Health, we took different approach. We used the CHNA process as a catalyst for engagement, bringing partners together, nonprofits, and residents into the conversations early and often is a must. Instead of just gathering data, we build relationships. We use those insights to strengthen collaboration and identify opportunities for continuous improvement and not just a periodic reporting. And that shift from static process to a dynamic community-driven process really helped Reid Health deepening their connections with the people it serves and building the lasting momentum for healthier communities. So once we establish the mindset shift that I mentioned in the previous slide, from compliance to connection, the next step was putting it into action. So for Reid Health, that meant designing our data collection process to do more than just like gathering information. We wanted to build engagement and capacity across the community. So together, Katie and I and like Reid Health CHNA team focused on three approaches. So first was community focused groups. Second was partner listening sessions. And the third was community survey. And you can see all these three methods and their clear goals on the slide. Through the survey, we gathered qualitative data on top health concerns and barriers to care directly from the community members' perspectives. From focus groups really like helped us understand the deeper stories behind those numbers that we got from the community survey. We got to know people's lived experiences, their challenges, and ideas for solutions. And lastly, but not the least, through partner listening sessions, we explored current and future capacity of organizations working on the ground. So what is working well in the community? Where more collaboration is needed or resources are needed? We got to know all about those things through partner listening sessions. So the benefit of all these three approach were powerful. We reached broader representation across the 8-county service area that Reid Health has. We engaged with the populations that often underrepresented in traditional surveys, and we built new connections between organizations serving those populations and the key sectors. So in short, the data collection became a tool for relationship building in this process. And that's where I think the real and lasting change begins.
Thanks so much, Era. Katie, I know Era just talked about the ways that you conducted the data collection this time around. Could you share a bit more about that shift from the key informant interviews to the partner listening sessions and what impact that's had on you all?
Of course. So historically, we have utilized the key informant interviews. However, we did shift to the listening sessions in 2025. And really, the reason for that was because we felt like group sessions allowed the leaders to build on each other's ideas, leading them to like deeper insight. And we also felt that by putting the leaders together in the same room, they could share experiences and highlight common challenges and opportunities across different sectors. So we were very intentional to be sure all sectors were invited so that they could work together through the process and gain new perspectives. So really, these sessions provided a space for relationships, leadership, networking for leaders who may not have even been in the same room together otherwise, which could lead to long-lasting impact. Additionally, we felt that the partner listening sessions were time efficient, to be honest, especially with the limited resources in many non-for-profits.
Yeah, thanks so much, Katie. Absolutely. I think we're excited about the outcomes from the partner listening sessions as well. I think earlier we were marveling at the engagement that you had with your community surveys and increased engagement overall with your partners. Could you share more about how you got so much community engagement and responses for your CHNA? I see there might be some questions in chat about that as well, so hopefully we're going to answer that in this next section.
Good. Yes, hopefully I do. And if I don't, keep them coming in the chat. We'll make sure to get to them. So our engagement, honestly, we took a community, took a look at the community as a whole, and really we realized that it needs to be maintained year after year. So I kind of sort of mentioned this in one of my responses in the chat already. So I always tell my team and others that these relationships shouldn't just be the Christmas card once a year. It really should have consistent communication and outreach to your partners throughout the year, similar to how you would water your own house plants, how I water my plants here in the office. The relationships you build within your community should be nurtured just the same. We don't focus on building, maintaining relationships with the organizations. We really build relationships with the staff and the teams. We know each other and we trust each other. So then before we show up for each other. Having these established trust in these relationships helps so much with this process, as evidenced by doing this alone we were only getting nearly 1,000-ish surveys. And then doing this together, it tripled that amount. So we really lean in on our partners to share the survey and the people who they serve, as well as the boards that they serve on, and really anyone else they can think of. I know that we had partners just sharing it out to their friends and family, because they thought when we say every voice counts, your voice counts, they took that literal and shared it to anyone. We put table tents here at the hospital, and then local restaurants and businesses and things that have the QR code, as you can see in the slides here, Spanish and in English, just to capture those. We gathered incentives for different meal sites and meal cards. So we did gift cards for $5 increments, which isn't much, but if you take a survey and get, that could be your lunch. So we did little meal cards, hygiene products for vulnerable groups. We met people where they were at meal sites and then in other community events. And I want to elaborate on the meal sites and kind of give a little example of one of the, honestly, it was personal for me because I'm the one that did it, but it was so, it just spoke volumes for our community. So to give the example, our community has a 3rd grade reading level. And at one of the meal sites, I sat down and read the survey word for word to people in, a smaller setting. There was 6 people at the table and then myself, and I was kneeled down beside them to read it. And it made people reduce the stress and the anxiety about just reading it and completing it, because that's a barrier for these people. The people we're serving, that is a barrier. So just that little, that's a memory I will have forever, and I'm so thankful for that. If we were at any community events or community meetings, we asked for a space prior to the meeting to be put on the agenda to share our survey. So everyone that we asked, our community was gracious and completely open to us sharing and having that 5-minute time to complete the survey. We also ran a My Chart campaign to push the surveys out to the patients who were active on our patient portal. And all of these efforts were really ingredients to such a successful recipe of engaging and including all of the aspects of the community in our CHNA efforts. And if you have a marketing team or marketing support of any type within your health system or hospital, I do recommend utilizing them in their expertise to help guide you in your efforts through the CHNA work. You should know your community and what works for them, and they know all of the tips and tricks and pointers around marketing. So it definitely did help us be successful in that piece. We did utilize the marketing team throughout the process of our current CHNA for 2025. We worked collaboratively to create images, flyers that you can see here, and other tools that look different from the standard hospital marketing pieces. We did create catchy phrases to explain what the CHNA was and why it was so important. So on the photos here are some of our engagement outcomes pictured. So the picture on the left is myself and a coworker, and we're tabling here at our main campus in Wayne County, Indiana. And this was really just to help employees know that their voice matters just as much as the community, because truthfully, yes, we all work for this health system, but we also are patients. Whether it's at this health system or somewhere else, we are patients. So our care matters just the same. On the right was a meal site that we went, and this is the one where you can see the stack of survey copies here. So that's where we went and tabled at the event that I got the pleasure of reading to the individuals to capture their voice. So really in the right side more than the left, but the vulnerable population that we were able to reach, we didn't really reach them historically. And in the past, our engagement outcomes naturally really lean just towards the internal engagement with employees. And we really wanted to focus our efforts this go around on capturing the voices of the patients that we serve and the community members that honestly, maybe we don't serve, maybe they aren't at our health system. So our employees, and then overall, really just including as many groups and people as we could to get a real picture of the health of our community from anyone in any different walk of life. And to touch base on just the continuous partnership and then our engagement on that. So our partners in the area did a great job of helping and gathering the voices. Like I mentioned about the paper surveys, we had numerous businesses and non-for-profits share the post or take those surveys. and have them completed and then return them back to us. And we kept our partners informed of every phase of the CHNA and also engaged in the CHNA process. So the same partners who helped us with the survey and all of that feedback, we invited them back to either the focus group, listening session, prioritization session, or they were invited to all of it. So there were some partners that were included in all steps to be able to get their voice. And so really the number is the output and reflection of the survey amount is really just the work and engagement that the whole team put into the entire process.
Yeah, that sounds amazing. And I love that tip about, including your marketing team, because that is a whole other area of expertise. So that's wonderful. Thank you so much for sharing so much about the primary data collection. So the data collection that like we're doing with you. There's this whole other side, the secondary data collection. So that's the data that we're gathering from like other sources. And I'd love to pivot a bit to that type of data collection and analysis. Era, would you mind joining back in with us and sharing more about Conduent's approach to reviewing and analyzing the secondary data with Reid Health?
Absolutely. So when it comes to the data side of things, our goal at Conduent HCI is to really look at the full picture of what influences the community health. So in addition to engaging community partners and collecting the local insights, we also spend a lot of time reviewing the secondary data. Because understanding health outcomes means understanding the broader context people live in. So as you can see on this slide, we use Barhai framework to guide that process. And my screen is really tiny right now here, so I cannot read okay, Barhai Framework Bay Area Regional Health Inequities Initiative. It's a long name, so I always mess up. So I have to see this other screen. So as you see on the slide, this framework, it's a really great visual for showing how both health and social determinants of health connect and why it's important to look beyond traditional health indicators to also include the social and economic conditions that shape them. So oftentimes, data tends to focus more on downstream indicators, things like disease rates, hospitalizations, or mortality rates. And those are important, but they only tell a part of the story. So we also consider what's happening in the middle of the framework, the living conditions that affect health every day, like access to parks, healthy food, or safe and affordable housing. And then if we go even further upstream, towards the left of the screen, we start to look at the underlying systems and inequities, such as access to healthcare, unemployment rates, the gender pay, or poverty. And these factors can have just as much, if not more, influence on communities over health, overall health. And at HCI, we make sure to review data across the entire spectrum. We also examine breakouts where possible by race, ethnicity, gender, age, group, and even neighborhoods to uncover the disparities that might otherwise be hidden in the overall numbers. And this equity lens is the key to understand priorities for the community health needs assessment. And finally, I do want to mention here is that much of this data that and the indicators that I talked about are coming from the trusted public sources like CDC, the American Community Survey, and local or state health departments. So combining all those sources with the local insights, giving us more complete community-centered understanding of these issues. And that's what helped drive action in the next phase of the CHNA process. Another way we provide local insights about the social drivers of health is through our Social Needs Index Suite, which you can see on this slide. These indices, Food Insecurity Index, Community Health Index, and Mental Health Index, summarize, summarizes multiple social and health indicators into one easy to understand composite score, helping communities to quickly identify where the greatest needs exist. So at HCI, we are, as you can see on the screen, support 3 indices, and each of these indices highlight areas that are most at risk for poor outcomes related to those topics. So this approach basically help us translate the complex data into clear local insights that can guide collaboration across sector. And building on that, it's one thing to identify areas of needs using these indices and secondary data indicators, but the next step is thinking about what we can actually do with that information. There's so much information out there. So going back to the bar-high framework we looked at earlier in the slide, this type of framework is really helpful as we move further into planning. It doesn't just show us the health and social determinants, it also helps us think about kinds of strategies that can make real impact. So we can work from individual and community level interventions to a longer term approaches that address the upstream social and institutional inequities like poverty or disparities in education. So a lot of conversation about the data, the planning. So let me give you an overview of data synthesis for Reid Health CHNA. I know we had some questions about how many survey responses we collected and focus groups we did. So this slide will give you an insight of the whole Reid Health data synthesis. So building on the framework, bar-high framework, and the insights from the Social Needs Index, the next step for me was to synthesize all this information to see the bigger picture for the Reid Health. And this slide gives you an overview of the data synthesis we conducted, bringing together insights from both primary data and secondary data sources to identify most significant health needs across the Reid Health service area. So we first started by reviewing and analyzing over 250 health and quality of life indicators, looking closely to all the trends, disparities, and emerging issues. Then we made sure this analysis, secondary data analysis, truly reflected the community's lived experiences. So we also incorporated the successful 3,649 community survey responses. We also added 5 focus groups representing diverse populations and 2 partner listening sessions that explored capacity, challenges, and opportunities for collaboration. That's a lot of data collection. So by weaving all of these data sources together, we were able to create a comprehensive and community-informed pictures of health needs, one that reflects both the numbers and the voices behind them. And you can see on the right, several key health needs emerge through this data synthesis, including chronic disease, healthcare access and quality, maternal and infant health, mental health, oral health, substance use, and the broader social determinants of health. And I want to highlight more about social determinants of health that came up in the significant health needs, because it was one of the strongest themes that emerged, especially around transportation, housing, and economic stability. So if you look at the graph on the right, the community survey revealed some telling insights. About 1 in 4 respondents said they don't feel safe in their neighborhoods, and 4 in 10 believe crime is a major issue. Access to reliable transportation also stood out. 6 in 10 respondents share that getting around their community isn't easy. And the most striking was 7 in 10 said there aren't enough affordable housing options where they live. So these findings highlight how deeply social and environmental factors influence health and well-being, and why addressing them is just as critical as focusing on clinical care.
Yeah, absolutely. This is something that we've definitely seen, I think, across the country, this emphasis on social determinants of health and, environmental and living conditions. I think what's special about Reid Health is how they took this on and really worked with their community partners to address those social determinants of health and the framing of it. So, Katie, could you share with us how Reid Health took these findings and really implemented something actionable in your community?
Of course. So Reid, we really took a new approach with our CHNA and focused our efforts more on the overarching lens of social determinants of health as we addressed all of the health, prioritized health needs. So this approach helped us do 4 big things, really. So it improved the health equity by identifying the barriers and then forming action items to address the barriers that we identified within the research available to us. So that was honestly a big piece to our findings. We enhanced the ability to fill the gaps in care by focusing our efforts on initiatives that make the programs, the activities available to everyone. Really by addressing all of the root causes of poverty, trauma, and other hardships that community members, individuals face. And then the driving the long-term outcomes by addressing all of the root causes that we identified. So we took all of the findings we had, we shared them with our partners, and did a series of exercises to identify the barriers and then identify ways we could address those barriers. So we used the big stickies on the wall and made it interactive and fun during those times. Because it is a lot of information, a lot of data. Era did a great job of sharing all of our data, and I'm a data person, but someone that's not. We wanted all of those interactions to be involved in things like that. So we have a series of the different exercises that we did. The information gathered through all of the exercises was then analyzed and used to map out Reid's community grant program. So for this, I will give an example of this, and it's our community grant program. We fund different food pantries to buy food. So we give them funds to buy food for their food pantries. Now we would encourage them, in meaning organizations, to create a proposal to us. And this proposal would not only address the hunger by providing the food, but it also provides a creative solution to addressing the root cause, such as maybe a wraparound service, follow-up resources that makes a long-term impact change, like helping guests get connected to housing or a job or a mobile pantry or delivery, really to address all of the transportation barriers. So as you see here, it is our reidcommunities.org. This is our website, and we use this to engage and inform our partners. So our team utilizes the data platform to identify and identify the priority health needs within Reid's service area. This helps while navigating both the funding decisions that we make and the outreach strategies. To date, we've been able to align our grant criteria with the top indicators under each prioritized health need through this website. This helps make this we also make this information publicly accessible to any of our partners, and there's direct links to the relevant indicators. We want this process to be easy for our partners. We also house our CHNA work, implementation strategy, grant information, and other community initiatives on this platform. And really, we encourage the use of this, not just for our grants, but for other grants as well in our community. We encourage the use of this for them to be able to go and get data points, and our partners to use. And we have magnets created when we created this website, or we have this website, we have magnets created with the readcommunities.org. And I hand those out almost every meeting I go to. I hand it out because if I know a grant cycle is coming up for our local foundation, we want to be able to share our data points and help them get good data pieces to include into their grant cycle. You can move on to the dashboards. Great, thank you. So pictured here is a dashboard, and it's tailored to their needs. So they highlight the data pieces for identifying priorities, and we create the custom dashboards with our chosen health indicators for our CHNA for really easy data pulling and monitoring. And not only for us, like I said, but for our community. And this also helps guide our grant program criteria. Like I mentioned, we do have our grant cycle. So this helps guide that and what the highest needs are. That's what our grants could be focused around. And then evaluating the requests for the community support. So outside of our grant cycle that I had mentioned, we offer cash donations for activities and programs that target our prioritized health needs. And we store all of that information on this website to make it a one-stop shop for all of our partners.
Thank you so much for sharing that. We love to see when our clients use our platform, and in such an engaging manner and sharing all the resources and data. That's exactly what we intended with it. So it's wonderful to see what you've done. As we close out, I think we're getting towards the end of our session. Could you just share, what are some key outcomes that you've seen with the process that you've engaged in? What are some lessons learned? So I always think about, if you were talking to Katie from 5 years ago, what are some things that you would tell her about lessons learned for this process, what she should consider? And where are things headed for you all? So what's next for Reid Health and the CHNA and IS process?
Yeah, I would love to share that, Jane. And honestly, some of the outcomes are exciting to me just because you have this program and you do the work and then you want to see the output, the outcomes of all your hard work. So really, I think that the site and all the work that goes into it, the transparency that we have, and the immediate access that our partners have to the prioritized areas, including all of the health indicators. I love that. The engagement, they stay engaged with our work and then our community health's work. Like I mentioned, it being a one-stop shop, they can utilize the website for grants, community requests, data pooling, really whatever to tailor it to their needs. The connection to the website and then leading to awareness for the local data pieces and the well-being. So we pull some data and we show our committee members here at Reid Health, our board members here at Reid Health, just to make sure that everyone really understands what our needs are and how we can tailor our work and tailor our daily efforts to reflect what's actually happening. And then the different funding requests, like I had mentioned, meeting the community needs. There's two pictures here on this slide that I will touch briefly. And the one on the left just is a mobile pantry that we have donated funds to. And they take this trailer of food and they go to usually a rural area, and they help with the food distribution of that. And then the one on the right is a group for recovery support. So they do a movie and group connection, and they, share and work together on just support of recovery in general. So those are just two smaller things that we've been able to fund, and they've used our site to get the information. Next is some of the lessons learned. So for us with our CHNA work, definitely expect resilience to change. People get so nervous when you change things up. And I encourage you all to just give them a space to share their concerns, their feelings, while still supporting them, and redirect them back to the ways that changes are happening, but they're positive, right? So provide clarity through every step. So create a space where you can have open conversation and talk through the process. Transparency definitely builds trust. So share with your partners every step of the way of what's going on. They enjoy being updated and are more likely to buy in and come to all of your invites and all of your sessions if you have that transparency and open through all of it. I encourage all of you to celebrate your small wins. Small wins are huge. This is a very big process with several different phases. Break down the phases and celebrate small victories like the survey milestone or the outreach events that you are able to get. And if you get 50 surveys during one outreach event, hallelujah, that's awesome. Like that's great. And it's easy to become overwhelmed. Don't lose sight of the end goal. Keep reminding and remembering yourself. And honestly, the amount of impact with the CHNA will have on your community once everything is done and it's all tied up. Define roles, because you cannot do this alone. Like I had mentioned, my department, it's me and 4 or 5 others. So we cannot do it alone without our partners. Include them in the community as key players and assign them to a role and define it to them. So when we invited our community partners to share the survey, we told them kind of what we expected, as far as like share this to your team, to the people you serve, your family, your friends, the boards you serve on. And we gave them like a little template that they could send out. So we did the legwork. They took it, copied it, sent it out to their platforms. And that was a huge help. People were like, yes, sending this out today. And that just took us 5 minutes to type up that pre-work. They sent it out. It in turn helped us out. Document. I'm a data girl, so documenting is so important to me. Save everything so you don't forget. Save pictures, sign-in sheets, scripts, anything and everything. Organize your files to reference them, of course, when you need them. And the last thing I will say about all of the lessons is definitely siloing your work will definitely slow the process. So include anyone and everyone. Branch out. If you have a sector that's unrepresented, bring them to the table and invite them. I promise you'll get some no's, but a lot of them will be yeses because they'll be so thrilled to have the invite. And last for me, what's next? So we will continue our transparency with our partners in our community. We will continue to invite others to the table, like I had mentioned. My team is pretty daggone great, but we don't have all the answers and all the resources. So we want others to join us. And nurturing ongoing partnerships, continue your efforts year round. Don't just send them that Christmas card. Keep checking in, keep showing up. Continue to build those relationships with your community, your friends, because your community will in turn become your friends. You see them at the meetings and the events and things, they become your friends. So last for me, change can be scary. And I know sometimes it's even difficult, but it is so necessary to really get that measurable, real impact. Health needs are changing, so our approach always needs to be everlasting and changing. And we will continue to evaluate our efforts and pivot as needed, even if it's before our next CHNA work in 3 years in implementation planning. We will pivot and we will tailor to what we need.
Thank you so much, Katie. And that's wonderful to hear. And I think that's one of the reasons it's great to have that platform, is because if you are pivoting, if there are any changes, you can make those changes live on the website, as opposed to, when we used to work just in like a PDF document, and once it's printed and if something changes, then it's outdated. So that's awesome. Thank you so much for sharing where you're headed. Your lessons learned. That was really exciting for me. I'm a data person too, so I love when you say that, and to document all that stuff, because it's absolutely necessary, but it's also the people part. So making connections, and I agree with you, having done this work, that this is not just work, that folks really become your friends, because you sometimes see them, especially during the CHNA cycle, more than your family. So thank you for those tips. So that concludes our presentation, and we're going to go right into the question and answer portion. I think Era and Katie have been answering questions along the way in chat while they weren't speaking, but we did have some questions that we didn't get to in chat. So I'm going to start first with Katie. How do you manage such a large collaborative, just like logistically? How often are you all meeting, and how are you managing getting to everybody?
Yeah, so we don't just create the partnerships, right? Like I had mentioned prior, we maintain and we nurture them. And between myself and my team, we do attend over 30 community meetings, coalitions, work groups, committees a month. So, and that is over our 8-county service area. So it is a lot, but if we can't make it to a meeting or something, we just communicate. Our partners understand, our partners trust us because of this. and know that they can count on us and count on someone to be there at those meetings.
That's awesome. Era, I'm going to direct this to you. So what advice would you give a CHNA that's trying to do what Reid Health has done? Because I know we work with clients across the country that are trying to do something similar.
I definitely encourage other CHNAs to start by really listening to their communities, like how Reid Health did, not just through surveys, but through conversations and partnerships that elevate local voices. And Reid Health's approach basically worked because they moved beyond checking in box and focused on the collaboration and inclusivity. Lastly, but not the least, because we all are the data people, I do want to emphasize on important to use the data as a storytelling tool, combining insights with lived experience to identify priorities that truly matter. And lastly, just be flexible, stay flexible. The process isn't linear. So that would be the top three advices I would give.
Yeah, thanks, Sarah. Katie, this one is to you. Are there good ways you found to be able to plug the CHNA data into clinical spaces for use by providers? So, for instance, providers to better understand and address social determinants.
So I would say being able to get the CHNA work into the data and clinical spaces for us would be and if we're talking about surveys, I would say we just really were able to get the capture of all clinical, non-clinical business side of our health system. But what is that how that was? Is it for survey more so, or how do you take that, Jane?
Yeah, I think I'm like trying to look back at who answered the question. I hope that answered the question because I understood it the same way.
Okay.
But if the person who asked that, if that didn't, go ahead and ask a
Yeah.
follow-up question. Hopefully we have time, or we'll catch up with you after. Another question we had was, can you share more about any legal privacy issues with distributing the survey via MyChart? And I know that's something you mentioned earlier in the session.
Yes. Absolutely. So when we sent it to the MyChart, we sent it to active patients in the service area, 18 and over. We excluded all admitted patients or patients that were on hospice. So we were very specific on who we even sent it out to, because there's a space for that, and then there's a space that you should not be getting a MyChart notification to take a survey in some aspects of your care. So we reviewed with legal and then with the privacy internal and our platform with the HIPAA compliant and all of those things. We did check with them, and the survey did not include any PHI information. So we also were able to connect with our patient experience team so that we were prepared to take calls as people knew, like, it wasn't spam or this was a real survey that they could take. So it wasn't just my director and I didn't just blast it out. We went through all the channels to make sure this was feasible, for one, and two, patients would be receptive of it.
All right. And I'm gonna push it. And we have one last question. Can you share how you worked with the health department and health system partners? I think you are also covered that. And we had the follow-up question to what we just asked about, which is how can we encourage our health systems to meaningfully use the CHNA data in clinical practice or in the clinics? I think that was the clarification.
Yeah, okay. Thank you, Hannah, for clarifying that. And honestly, I would say be so mindful of the patient when they're coming in. So we have had lots of our community health team does a lot of prevention work and things in our health system. So they do connect with physicians. And I would say being able to get the clinical side and being able to connect them to the community health needs assessment, make them aware of it. Some physicians or even nurses, clinicians in our facility, they might have not been aware of what the CHNA was and what we did, but this go around, we wanted every employee to know about it. So when they saw it on Facebook, they shared it and said, hey, this takes 2-3 minutes to complete this survey. We want to hear your voice as well. So really, I would start ground level. I would start just making them aware of what a CHNA is and why we do it. And it's really to capture those voices of our community so they can help us know what they need. We don't want to just call it and say, this is what we're going to provide to you. We want you to tell us what you all need. And Jane, if you're okay, I will go ahead and say what my answer is for the health departments. Is that okay?
Yeah.
Okay.
Yeah, let's.
So for our health departments, we work very closely with Wayne County Health Department in I would say a lot of aspects. One being we have wrote grants to the Wayne County Health Department and received funding, so we've had to partner in that lens, as well as we invite them to a lot of our events, even if they're not around CHNA time. But we want our health department to know what our health system is doing and stay in tune with one another so we can help each other. And for our CHNA work, the director of the health department came to all of that because that personal invite of saying, hey, we want to know what you all are finding at the health department and how we can help the communities that we serve every day.
All right. Thank you so much. And thank you for taking that last question. And it actually looks like we're about at the end of our time. At this time, I'd love to thank Era and Katie again for your time. And of course, thank you to those who are able to stay with us till the end. We've put our contact information on the slide here. So if you have any questions or if we missed you, we'll follow up with you. And for our current clients in attendance, if you have any questions, please reach out to your account manager or project manager. And thank you again, everyone, for joining us. And that concludes our presentation. Have a great rest of your day.
Thank you, everyone.
Thank you.